So the question being, how many procedures will you need in your lifetime? That question varies very much case by case, depending on your genetics, your age, your ability to take medications to stabilize hair loss. So there are several different factors involved in that decision. However, the earlier, just as a general rule, the earlier you're on in your hair loss journey, that would make it harder to predict versus someone later in life who doesn't have a large area to cover. You know, their hair loss is stable, they're on medications. That patient may not need multiple procedures. So if some patients are earlier in their hair loss journey, in their 20s or 30s, it's very hard to predict how much hair loss through time that they'll have. So very likely as they continue to lose hair, they will likely need multiple procedures. How many is very hard to say, it depends on the case. Versus a patient who is later on in life and they just want to make small changes, we can tell more steadily from our microscopic evaluation what areas are losing hair, so we can also to some degree predict what patients will end up like, and also using family history.